Hi, thank you for coming. How are you?
Hi, good.
Good. Alrighty. How do you feel about last visit's checkoffs? Do you feel like they're still obtainable? You feel like you're making progress?
Yes, I've actually started brushing twice a day now,
Very
as
good.
well as brushing my tongue.
Okay, perfect. Well, now with that good news, I'll go ahead and give you today's good news as well. So today's plaque and bleeding score. Today's plaque score was a 2.4, which is considered fair. That is a big, we made a little jump from poor to fair. And then our bleeding score was 45%. So we went from 62% to 45%. So we definitely are doing better at home with our home care because we're decreasing. Alrighty, just to review over last week's topics, do you remember what plaque is?
Plaque is a bacteria that forms on the teeth.
Yes, and how many times should we brush a day?
2 times.
For how long?
2 minutes.
Perfect. Alrighty, that was a great recap. Okay, so today we're going to go ahead and go over today's long-term goal number 2. Long-term goal number 2 is halt the progression of periodontal disease by reducing the bleeding score to 0%. Our 3 short-term goals under that long-term goal is understand what periodontitis is and the cause of periodontitis, reduce the bleeding score by 20% at each visit, and demonstrate proper flossing technique and start flossing once a day. So I know periodontitis sounds a bit scary, but the reason I am doing periodontitis for your care plan is because I made this specifically for you. So you do have some slight some slight recession on some of your teeth. Have you noticed that some of your teeth, your gums go a little bit lower? Yes, so that's some slight recession. So you have slight periodontitis going on. Alrighty. So starting off for today's visits, can you tell me what periodontitis is?
No, but it does look like the gums are a little swollen and red.
Yes, you are correct. Let me go ahead and elaborate a little more. So what is periodontitis? Periodontitis is, well, you just named a symptom, so that's great that you noticed that. But periodontitis is a serious gum disease that harms the soft tissues and bones in your mouth that hold your teeth, okay? Alrighty, and like you said, what are some signs and symptoms? You said inflammation, looks red, inflammation. Yeah. You're right. So some other signs and symptoms include swollen or bleeding gums, bad breath, receding gums, loose teeth, and painfulness when chewing. Have you experienced some of that?
Yes, in the back, for sure.
Yes, in the back. Yes. Okay, alrighty. Do you happen to know what causes periodontitis?
No, ma'am.
No? Okay. Well, what causes periodontitis is poor plaque control. So do you remember how we spoke about plaque and how we want to brush it off? So sometimes if you don't get that plaque under control, it stays on there for a good time, and after a while it hardens like a rock. And so say this is your tooth and this is the rock. The plaque builds up and it hardens. Your gums don't like that hardness, so it wants to get away from it. So it starts receding and receding and receding down to get away from that calculus. So we want to make sure that we're keeping that plaque control good, maintained. Okay? Alrighty. And do you happen to think, by looking at these pictures, do you think periodontitis is reversible or irreversible?
I'm hoping that it's reversible.
Reversible. Unfortunately, periodontitis is irreversible. Periodontitis is irreversible because, can you see how his gingiva is going a little bit down? So periodontitis is bone loss. And so once you lose that bone, unfortunately, you cannot regain that bone. There's no way of regenerating that bone and making it heal itself. So periodontitis, once you have periodontitis, there's no going back from having periodontitis. But the good news is that you have slight periodontitis, and with our based home care and our goals, we can stop the progression of periodontitis and just keep it slight. Okay? Alrighty. Do you have any questions?
No, ma'am.
Can you tell me what periodontitis is?
Periodontitis is a severe gum disease.
Yes, it is. And it causes loss of what?
Bone.
Yes, perfect. Alrighty. Okay, and then so next we're going to go ahead and go into flossing just to help. Flossing is going to help us halt the progression of periodontal disease. Okay.